Hello everyone, myself Miss Alexi Parmar, working as a nursing tutor in Knowledge Institute of Nursing. So our today's topic is vital signs. So vital signs is a topic from unit number 7, that is from the fundamental of nursing subject. So what is vital signs? Introduction. Vital signs are the indicators of the body's physiologic status and response to the physical environment and psychological stressors. So vital signs are an indicators that indicates us through the responses of the body or any changes that have been happening inside the body due to some of the changes in the body, that are the physical and environment, psychological stressors, as well as the physiological body changes. Now, the vital signs or the cardinal signs. So, the vital signs is also known as cardinal signs. So, that includes the temperature, pulse, respiration, and blood pressure. So, the findings are governed by the vital organs. So, temperature, pulse, respiration, as well as the blood pressure are being governed by some of the vital organs in the body. Now, what are the vital signs or what it includes? That are temperature, pulse, respiration, blood pressure, oxygen saturation, and pupillary reactions or pain. Now, definition of vital signs. Vital signs are otherwise called cardinal signs, and these are the indicators of the health status, as this indicates the effectiveness of circulatory, respiratory, neural, and endocrine body functions. So these are the indications that indicates some of the health status or the changes in the body, and that gives an indications of an effectiveness of some of the changes in the circulatory system, respiratory system, neural, as well as some of the endocrine body functions. Now, purpose of assessing vital signs. So, why vital signs is much important or useful? First point is to determine change in client status, that is we can determine or check whether the client status or the health status is appropriate or not, to recognize variation from normal and its signification. So we can recognize or identify some of the variations that can be take changes or make changes in the body, to help physician to prescribe right treatment. So after assessing or recognizing some of the changes in the body, the physician would prescribe an perfect amount of the medications and perfect treatment for such alterations in the body. Next point, to identify specific life-threatening condition. So by assessing the vital signs, we can identify some of the life-threatening conditions that can be included in that cardiac arrest, some of the hypovolemic shocks, etc. Next, to detect changes in client health status. So as we see in upper points, that are the we can detect or we can indicate some of the changes that the client feels or the patient feels in the body. Next, to help in diagnosis of the disease and the result of the treatment and medication. So assessing a vital signs can also be helpful in diagnosis the diseases and the result of the treatment and medication. So what all the treatments have been given for a particular diseases, so we can identify or indicate some of the results from that according to the disease conditions. Now, when to take vital signs? So, when vital signs is necessary to be done. First point, upon admission. So, during admission in the hospitalized hospital, we should take vital signs, that we have to check all of the vital signs. Next, on a routine basis. So, on a routine periodic checkup, vital signs is important. Next, before and after invasive procedure. So here, what is invasive? Invasive means some of the things that some of the articles or instruments that have been invaded inside the body. So before and after some of the invasive procedures is been done in the hospital. Next, before and after administration of medication. So after giving medication and before giving medications, nurse or some of the health personnel should take vital signs. Any deterioration of patient's general condition. So if there is some of the ups and down in the patient's general condition, so we can or we have to take vital signs to check whether the patient is all right or not, or what all the changes are been there or going on inside the body. Next, before and after nursing interventions that may influence the vital signs. So after or before doing some of the nursing interventions, that are the some of the procedures that have been decided for the patient according to his or her disease condition. So before and after doing some of the procedures, we have to check the vital signs, that if it affects the patient's vital signs or not. Next, prior to medical emergency call, that is medical emergency team. So before the medical emergency team arrives at an emergency condition or emergency case, we have to priorly check the vital signs. Now, normal vital signs. So what are the normal values of the vital signs? So for the body temperature, the normal range is 98.6 degree Fahrenheit or 37 degree Celsius in adults. In pulse, 72 beats per minute in adults. Next, respiration, that is 16 breaths per minute in adult. And blood pressure, that is 120 by 80 mm of Hg.